care delivery. Well, this is actually the title of a letter I had sent to the journal Education for Health in 2010, and here I had actually started with a report from the World Bank of 2005. I am giving the excerpt here. What they said: a detailed survey of the knowledge of medical practitioners for treating 5 common conditions in Delhi found that the average doctor in a public primary health center has around a 50-50 chance of recommending a harmful treatment. Now, if this is the condition of the doctors, then what is the likely condition of the patients? Well, let me take you slightly back in time. In 1995, I had actually written a guest editorial in the Journal of the Indian Medical Association that was titled Medical Informatics. Are the doctors ready? Over the next decade, I had been actually trying to lay a sort of roadmap and influence the policymakers, and starting courses on medical informatics or biomedical informatics or health informatics, as it's known in various names. I had been involved in research and education training, including the application of Web 2.0 tools for health informatics and health education, how to spread it, not only in the region, even beyond India, and I'll be talking about that. This is actually the editorial I was talking about. In PubMed you can see it's Medical Informatics, Are the Doctors Ready? That was 1995. Well, even 17 years later, I don't think the answer is in the affirmative yet. So these are some of my relevant publications in PubMed. I'm not going into the details. Now, all this time, what has the government been doing? Well, they have not been sitting idle either. In the year 2002 to 2005, the Ministry of Communications and Information Technology had actually published the IT infrastructure for health. Just note that it's not the Ministry of Health, but the Ministry of IT. So the Department of Information Technology actually brought out this document. I'll be talking about it more. Then in the period 2005 to 2008, we had the National Knowledge Commission. They had come out with lots of recommendations, including some related to healthcare. One of the important ones is the Health Information Network. And there were working groups formed for various of the action plans based on these recommendations. There was a working group formed for health literacy and health portal. Another was formed on this Indian Health Information Network Development, or IHIND. Another working group worked on emergency medical services. Then in the year 2010, towards the end of it, the Ministry of Health and Family Welfare of the Government of India, they formed an expert committee for the standardization of electronic medical records. This year, if you had been noting, the Steering Committee on Health for the 12th 5-year plan, they have also come out of a lot of guidelines, and that includes the formation of a health information system for the whole nation. Now, what was there in this ITIH, or Information Technology Infrastructure for Health? This document is in the public domain. You can have a look at it. If you look at the mission, or rather the vision, they were saying to define information technology infrastructure for health in India that will standardize the capture, storage, and exchange of health information in an environment supported by a robust legal framework and a mature health informatics education system that will bring administrative simplification and improve patient care services by providing a continuum of care. This document, remember, it is more than 7 years old. And if you look at the figure within the document, you would be seeing that education is there at the cornerstone. That's something probably we can't ignore. And it may sound not very common, but education is not really just in the domain of the educators or the policymakers. Now, if we look at the National Knowledge Commission, so this is the recommendation I was talking of about the formation of the Indian Health Information Network. And as I said, as a follow-up activities of the National Knowledge Commission, various working groups were formed. I have been fortunate enough to have been involved with some of those. The Health Literacy and Health Portal Work Group, they actually had proposed the formation of the India Health Portal, which is supposed to be under the aegis of the Ministry of Health and Family Welfare. It would be hosted by them, and work is in progress. So what are the features? There would be a health portal where you can get all sorts of health information, not just in English or Hindi, but also in the vernacular languages and even in pictorial form for those who are not literate. And this is the other thing I was talking of. Just having health information is not enough. They need to talk to each other. You can't have isolated silos, watertight compartments. So what do you need? You need standardization for healthcare information exchange. And the first step towards this has been the formation of this expert committee for the standardization of electronic medical records. And the work is still going on. So if we look at it, it may be said that the government's efforts are really work in progress. In all this time, what has been going on all around the world? There's a movement called HIPAA 2015, or Health Information for All by 2015. In the public domain, we can get lots of healthcare information. In fact, those who are aware, even there have been research papers where it has been shown that Google alone can even make correct diagnosis for rare disorders. The Pittsburgh University, they launched a WHO collaborative program. They've called it Super Course, and there are lots of lectures on public health is available free to anyone. More than 5,000 lectures are available there. And then, of course, the Web 2.0 tools, the wikis, the social networks, and we have this term called user-driven healthcare. So it's not a doctor-centric healthcare, but it's the user, the patient, who can be actually dictating what's required to be learned, to be shared among each other and for the others. Of course, there are discussion forums, and I'll be talking about a couple of those. This is the website of the HIPAA 2015. So if you look at this, you can see at the tagline, you can see the people are dying for lack of knowledge. And it's not just the patients or the family members or the caregivers who are at fault. Maybe even the healthcare delivery personnel, they are not really fully informed. They are not up to date. So if we really think of tackling this health literacy, whom should we target? We can target the school kids, the college kids, the students for healthcare professions, and also the practicing healthcare delivery professional. That would include the physicians, the nurses, the paramedical personnel, and all others. This is the discussion group of the HIPAA 2015 forum, where lots of points are raised and issues are discussed on how to deliver quality healthcare, especially in resource-poor settings. And this is the HIPAA 2015 page in Wikipedia. You know, Wikipedia, and I believe many of you may be editing Wikipedia as well, that's an excellent example of this Web 2.0 platform, where everyone can share their ideas, their knowledge, exchange the ideas, so that the best possible information is available on any topic. Similarly, the TED Talks, these are also offering a good platform where you get excellent ideas, and there are lots of TED Talks related to healthcare. One of the things that you can do, you can also translate these talks in your own language, and this way each of us can actually contribute and enhance the knowledge pool. Similarly, in the super course, there are so many topics of interest, and people are putting up lectures, and you can search on any pertinent topic, and certainly you'd be able to get some of the most up-to-date information there. Now, apart from all these, nowadays probably all of us are staying more in the cyber world, on the online social networks. And healthcare, yes, healthcare can also be practiced with high precision through these. This is one of the examples. This is a group in Facebook where real cases are discussed, of course, with the identifiers. The real patient confidential details may not be disclosed, but real patients do participate, discuss their conditions, and medical students, doctors from all around the world interact, and getting similar views or similar ideas from some other places can often help in making things better. So it's helping both ways, direct healthcare delivery as well as learning for all those who involved with it. Another very powerful tool, Web 2.0 tool, is Wiki, like Wikipedia. And this is also being used very much for our educational systems, whether it's for health professionals or others. So I'm showing here one of the wikis. This is being maintained by the Bangladesh Institute of Health Sciences. And here you can see the faculty, students, all are coming together, regularly updating the pages, exchanging information. And right now it's of course only in English, but they would be having their own Bengali editions as well. And similarly, wherever we can get a chance, we can always interact through this, enhance our own knowledge, and also serve the others who badly need it, information in any form, at any time, any place. Discussion forums can certainly be another very nice platform where we can exchange ideas. If you remember that Einstein's saying that if I exchange an apple with you, each of us are left with one apple, but if I exchange an idea with you, each of us leaves with two ideas. So in the discussion forums, exactly the same thing is happening. We are actually asking a question which may be the question of many, and once the answer comes, everyone comes to know even without asking, and each of us can go on enhancing the quality of the discussions. So this is a discussion forum of the members of the Indian Association for Medical Informatics, and this is another discussion forum which is for the medical education units in India. So more than 1,000 members. They are all health professional educators all over India who are actively discussing many issues which are of relevance for healthcare delivery and education. So now let me just summarize whatever I've been saying. Healthcare delivery, especially in India and the region, is hardly informed. And the sadder thing is that we are hardly aware that it is so. Had Socrates been here, he would have certainly called us fools, because we don't even know that we don't know anything. Certainly something needs to be done. And as I said earlier, it can be done by each of us. We need to have awareness and capacity building. That could be professional. We can train people to become health informaticians who can then further go on training others. Or we can also do individual capacity building, and there's not only the need but also tremendous scope for it. We can use the Web 2.0 tools, whether it be the blog, the wiki, podcast, or the online social networks. We can interact with each other and contribute meaningfully. There are lots of useful healthcare information, authentic resources available in the public domain, and each of us can help by translating in our own vernacular, help people to understand it, and not just in text, but even pictorial or other forms of arts like music we can always incorporate. So to sum up the whole thing, I think let us all pledge that healthcare delivery must be informed. Thank you.